Hello, everyone, and welcome to Fertility Talk, the Alpha IVF KL podcast series, where we brew out meaningful conversations about fertility, health, and everything in between. So, my name is Diana from Alpha IVF Group, and today's topic is one you won't want to miss. So, today we're going to dive in very deeply on the topic Preserve Your Future, Fertility and Cancer Awareness. Next to me, we have two handsome gentlemen. We have Dr. Leong Wai Yew, Consultant O&G and Fertility Specialist from Alpha IVF and Women's Specialist. And then we have one more, Dr. Chih Kiang, Consultant Clinical Oncologist from Picaso Hospital. All right, Doctor, how are you?
I'm great. And how are you?
I'm good. Dr. Tan, how are you?
I'm great too.
Is this your first time coming here?
Yes, it's
How
my
are
first
you
time
feeling?
here. I'm feeling all right. I think it seems like today is a good day, so I think we should be able to have a good conversation later on.
Yes, I hope too. All right, ladies and gentlemen, so without further ado, let us proceed with the first question. Okay, Dr. Tan, let me ask you first. What is the most common types of cancer affecting men and women now?
So I think if you were to look at, based on our own Malaysians data, the top three cancer affecting the female will be, top one will be breast cancer, followed by colorectal cancer, and then lung cancer being the third one. Whereas for male itself, the commonest is colorectal cancer, followed by lung cancer, and the third one will be prostate cancer.
So why do these types of cancer actually so prevalent?
I think that's a good question. I think it's actually very difficult for us to pinpoint the actual cause of why these cancers are more prevalent. But generally, breast cancer, it is the commonest cancer, even not just Malaysia, but affecting all the females worldwide as well at the same time. Of course, I think generally we will say that the cause of the cancer can be multifactorial. Right? Like example, family history, exposure to the environmental factors like stress, the food we take, pollutions, and things like that. And of course, we always say that family histories or whether is there a genetic component causing breast cancer itself. So for breast cancer in particular, generally I would say that about 5% of breast cancers are due to genetics, whereas about 15% are due to family history, right? That means that you have first degree family history with breast cancer, and the rest are generally multifactorial, which normally we don't really able to pinpoint the exact cause for it.
Okay, so Dr. Leong, now it's your turn. As a fertility specialist with more than 20 years of experience, what are the biggest concern patients voice to you about starting a family, especially these people that being diagnosed with cancer?
Yeah, I would think in your question you probably mean those that have been treated with cancer, I suppose some cancer survivors. So mainly two things that they be worried about. Number one, am I still able to start a family? How is my fertility after the cancer treatment?
Okay.
The second biggest question would be, will the treatment or will the pregnancy cause a relapse of my previous cancer which I've been treated? So these are two main things I would think. For the first one, whether they are still good for the fertility, well, it depends on the adjuvant therapy that was given during the cancer treatment, whether it's radiation, whether it's chemotherapy. Dr. Tan will be expert in that. Sometimes they cause some problems with the gonads. Gonads meaning the testes in the man and the ovaries in the female. So whereby the sperm or the eggs will be affected in terms of quantity and also quality, therefore affecting their fertility. Of course, we do a full assessment for them in such cases to see whether they're still good, whether there's still good amounts of eggs being ovulated from the ovaries, and how the sperm levels at the point. So there'll be a major concern for cancer survivors. The other thing that I talked about was the whether it will cause a relapse just because they got pregnant. So this one is pertaining the ladies, of course. So in certain cancers, for example, that is may respond to certain hormones, for example, estrogen, the female hormone, say breast cancer. Some breast cancers, they are estrogen receptor sensitive or positive. So in these cases, the spike or the increase in the estrogen may cause the flare-up of the cancer. So this is something we have to address, of course, with the help of our medical oncologist. She has to be cancer-free, deemed safe to undergo pregnancy, let alone IVF. So they must be healthy enough to go through pregnancy. Then we as fertility specialists can proceed with our treatment, to help them achieve what they want.
Okay, so like both of you,
Yep.
is it usually young patients that come and consult related to cancer treatments?
Yeah, so I'll just to add on to what Dr. Leong mentioned it earlier, right? I think this is a very important subject or matter that nowadays we tend to talk about a bit more compared to previously. I think two main reasons for that. Reason number one will be even in advanced cancer patients, right? Nowadays with the advancement in terms of like, drug developments and things like that and treatments, many of these patients, even though they are diagnosed in advanced stage, but they actually tend to live for many, many years. So previously when they have like, short life expectancy, so they don't really think about all these fertility issues, wanting to have a family.
Correct.
But nowadays, even when they are diagnosed with advanced stage cancer, but when they actually, once the disease has been stable, well controlled, and they live beyond many, many years, then these are generally something very common for them to start thinking about, whether am I still able to have a child, or whether am I able to, have my own family and things like that. And even for those who are early stage, I think like example breast cancer, we are seeing a trend where more younger and younger patients
Correct.
are being diagnosed with cancer. And then these are talking about, a group of females, they're not in their 60s or 70s, you're talking about those who are in their 30s, 40s, where that's the most active phase of their life, where, they are probably just come out to work, or they just started a family, or they have plans to have families, So this topic is something very pertinent nowadays that, that we always talk about, for patients with cancer itself. Yeah.
So like Dr. Leong, for you yourself, like when you consult with this patient, do they actually aware that it has something to do with their fertility to undergo this kind of treatments?
Yeah, it's a good question. Most women will, but you don't be surprised. Still, a big number does not. They would have gone through the treatment without realizing that it will affect their future reproduction and fertility. And when they come to us, we are starting at the back foot, because chemotherapy or radiation has been given, and then there's less resources for them to get pregnant. Yeah. So, but a lot of them, the younger ones now, they are very well read. They know what's happening. And a lot of the with the help of the medical oncologists, who will guide them when they are being seen at the oncology center. They say, hey, you're a young lady, you probably still want to have family in the future, and why don't you consider XYZ treatment with the fertility specialist, before I undergo all this adjuvant therapy like chemotherapy, radiation. So a lot of them they know, and then they come to see us before, or they come in conjunction with the help of the medical oncologist to treat them before they undergo their treatment, their cancer treatment.
Okay, all right, nice. Well, Dr. Tan, how cancer treatments like the chemotherapy and radiotherapy actually give a big impact on fertility parts? Because I believe, like Dr. Leong said just now, not many people would know. Maybe they would know the base. Yes, it will affect, but in what way actually?
So generally, not all radiotherapy can cause problem with fertility,
Okay.
or not all chemotherapy can cause that as well at the same time. So generally, I think it is important, being an oncologist who are treating young patients, to spend a bit more time, to talk to them and explain to them, because a lot of time you tend to realize that, during the initial diagnosis of the cancer, the main concern for the patients and the family is actually to treat the cancer. Right, they want to have a treatment as soon as possible. They want to do a surgery to remove the cancer. For them, those are the priority. Then, even though they're aware that the treatment that is going to be given to them might affect their fertility in the future, but at that moment, those are secondary to many of them. But it's actually our role as their doctors to actually share with them, to and remind them to not to make the decision, so fast. Right, take some time. I think the cancer can wait for a couple of days or even a week or two, for them to actually think about it seriously, about this topic, about fertilities, about having their own families in the future, talk to their husband, talk to their spouse, talk to their family members, even if they are not married at the moment. Because once this phase where the cancer has been treated, when their lives slowly get back to normal, those will be their priority then. But right now, of course, that is not their priority. So, but if you were to make your decision wrongly right now, and say that, it doesn't matter, doctors, just start me on my cancer treatment right now. They might regret it in the future. So I think it is important for us, being the doctors, to actually spend a bit of time, to explain to them, and then try not to push them to make a decision soon at that moment. Give them a bit more time to go back and think about it. so that they will not regret their decisions. And back to the question that you asked earlier, right? For radiotherapy, right? Probably I will just say that not all radiotherapy can cause problem with infertility. It actually depends on where you give the radiations, right? So generally there will be two sites where when you give the radiation, it might affect the patient's fertility. Number one is that when you give the radiotherapy to the pelvic region, that's where when the gonads, which is where the testes or where the ovaries located, right? By giving the radiation, they can affect the function of this gonad, so-called, and hence it can cause the patient to have infertility issues in the future. The other area that radiotherapy can cause problem is when you actually give the radiation to the brain. Because when you give the radiation to the brain area, especially when you actually, the radiation affect the pituitary gland, right, which is one of the glands involved in secreting hormones that will also affect the fertilities and things like that, then it can also cause the patient to have this fertilities problem. And then back to the other one, which is chemotherapy, right? So, of course, chemotherapy in general, they can cause problem to fertility issues as well. So how does it cause is that because, number one, they affect the hormonal imbalance in the body, right? And second thing, they actually affects the functions of these gonads, the ovaries and the testes. And hence, in a way, they can cause either a temporary or permanent damage to these structures. And hence, it will help, in a way, it will cause the patient to have a lower chance, to conceive in the future. Yeah.
I see. Okay. I hope you guys actually now take note that not all of it actually can give impact to fertility. It depends on the location where it's being targeted, correct?
That's for radiotherapy, yeah.
Radiotherapy, yes. Okay. So, Dr. Leong, now we want to talk about fertility preservation. Like when you said just now, when patients come, and do you always meet like those patients that too late to start these fertility preservation treatments? Because they have like the kind of awareness just reached to them pretty late.
Yeah, we see all types of patients, in my practice. Some pre-treatment for cancer, some post-treatment, after treatment for cancer. Now, for the pre-treatment, the ones before they undergo cancer treatment, it makes life slightly easier for us and for them. With the permission, of course, with the medical oncologist that says, they can undergo these various therapy cycles. Mainly, we are talking about either sperm freezing or egg freezing in general. In rare cases, maybe embryo freezing for married couples. So with permission to start, that says the female patient that's going to go through cancer treatment, if it's okay for me to use my hormones, which are basically gonadotropins, then we will do so. In certain cancers, for example, breast cancer, like we mentioned just now, although the gonadotropins or the hormones which I use doesn't strictly affect the cancer, but because of the treatment, when the lady develops eggs in her ovaries, the ovaries will release estrogen, which may cause a problem. So we have to work hand in hand with the medical oncologist, see whether it's okay. Similarly, in a way with the men. So if it's okay, then it's simple. We will proceed with our egg freezing protocols and save the eggs for the future. For men, it's even easier. Just give an ejaculate. We freeze the sperm. We freeze a couple of times, and they're good to go. Then they can undergo their cancer treatment. For the other arm of patients where we talk about, they already had treatment for cancer, and they are deemed cancer-free. Of course, that's why they're seeing us for fertility. They can have children after treatment. So then it's a bit of a uphill slope for this one. So hopefully, like what Dr. Tan has said, the treatment that they undergo did not affect the gonads at all, or the effect to the gonads is at the minimal. Then we should have no problems, undergoing various kind of treatments, IVF or what have you. If they did affect, but it's not total gonadal failure, meaning not total testicular failure or not total ovarian failure, then of course, we can still undergo IVF. In fact, we should undergo IVF and try to give them a child as soon as possible.
Okay, so meaning that those patients that are being diagnosed and like cancer-free or even like in the middle of having those kind of treatments, they still can conceive naturally.
Yes. So maybe I just chip in to what Dr. Leong was talking about earlier, is that I think just to reassure to the patients and the public is that there are studies being conducted nowadays, right? And I think recently, probably last year or this year, there's a study being done on breast cancer patients, young breast cancer patients, right? Like I said, during the initial period when they have treatment, they don't think about all these fertility issues, right? But once the things are controlled, they have removed the tumors, they have completed most of the intense treatment, when they are on these hormonal therapies, then they started thinking, whether should I have to wait? Because this hormonal therapy, sometimes patients need to take for 5 years, 7 years, or even 10 years. And probably by the time they completed the treatment, they would have passed their childbearing age. You see, so there are studies being conducted. You're talking about good numbers of patients in the study, good quality studies, which shown that, after they have fulfilled certain criteria, it's actually safe for the patient to stop their treatment, the hormonal therapy, right, for 2 years duration to allow them to actually conceive and deliver, and then resume back their treatment after that. And this gap of 2 years when they actually stop their so-called hormonal therapy does not actually increase their risk of getting a relapse or a recurrence compared to someone who actually continuously taking it without a gap in between. So this kind of studies actually reassured you that, for some patients who fulfill the criteria, you can actually safely stop the treatments, and then for them to actually go on with their life, to complete their families, to have their child, and then subsequently resume back the treatment without affecting their outcomes in terms of the breast cancer. Yeah.
Okay, but it definitely needs to be advised by the oncologist, correct?
Of course, it's not something which is for everyone. So I will always advise them, always talk to your doctors, what you wish to do. There's always options. Of course, your doctors, you will actually advise accordingly, based on individual situations.
Okay. Well, Dr. Leong, like you said just now, a lot of people come when it's too late, and some people also like, I just nak sihat cepat je. So this will come later. But as a fertility specialist, of course you have your thoughts on why is fertility preservation actually very important, especially for this group of people?
Yeah, because there's actually avenues to help them, in the future. It's probably a lack of knowledge, or that they didn't undergo certain treatments like what we've mentioned before their cancer treatment. So that's why in such cases they're basically treatable, both for the cancer and also their reproductive health. So if we catch them at the right time, we do the right thing, then we will solve a lot of their problems. So that's why it's a bit special, to me, for these kind of patients. Yeah. Education is key. Yeah.
Yes, correct.
Yeah.
Well, I think freezing treatments not very popular still, correct?
You'll be surprised. Nowadays a lot of women they're very well versed, very well read. So because even not talking about cancer treatment per se, we're talking about fertility preservation. They are healthy people, but they may not want to have children now, but they know in the future they're going to have problems because of human biology. No pathology or no diseases, just the normal human biology of aging. Yeah. So they freeze their eggs, for example, for ladies, when they still can, while they still can. Yeah.
Okay, nice. All right, Dr. Tan.
Yes.
In Picaso Hospital, like have advancement in cancer treatments, like the technologies in the hospital, like the targeted therapies and all, minimize the side effects for all these patients.
Okay, so I think generally besides chemotherapy and radiotherapy, some patients we actually also uses other kind of treatment to treat them, right? Of course, example will be things like targeted therapy, immunotherapy. And then nowadays we even have a newer group of drug called antibody drug conjugates. So all this treatment does helps to control or cure the cancer, right? But of course, I think because these drugs are generally newer compared to your usual chemotherapy drugs, so the effect of these drugs, causing the fertility problem is not that well studied at the moment compared to your usual chemotherapy. Because generally chemotherapy has been around for decades, so they have been well studied and the side effect has been well documented. Whereas because this targeted therapy, immunotherapy and all this, because the way of the drug works is very different compared to your usual chemotherapy. So they actually acts on certain targets. In a way they has lesser effect towards the other treatment. But at the same time, generally we felt like they have lower risk to cause infertility issues compared to your chemotherapy. But bear in mind that some of these drugs also can cause teratogenic effect as well, which means that they can cause problem to the babies, during the development. That means that the baby, when they're born, because while you're on this drug, they can potentially cause some issues to the baby health. So sometimes it's not just on the fertility bit, but it also can cause problem to the baby. So it's always good to talk to your doctors, in terms of the stage of the disease, the type of treatment that the patient is undergoing, whether the patient actually is fit, to actually go on to have some, to conceive, to get pregnant and things like that as well. So always talk to your doctors. Yeah.
Okay, so is it true that in the infertility cases with the cancer treatments make these patients menopause a bit earlier than the actual age? Is it correct?
Like what Dr. Tan said, yeah. So certain agents, I think predominantly we talk about chemotherapy, because they can have a systemic effect, meaning the effect can affect all the cells in the body. So, and of course, the sperms and the eggs also are certain cells in the body. So if that's affected, that can be a problem. The problem with or not the problem, the issue with the human gonads is the cells have problem regenerating. More so in the women. For example, women, they are born with a finite number of eggs. A lot of women don't know that, but they're born with a finite number of eggs. They cannot grow eggs. They cannot make new eggs. They're just born with those number of eggs, which since puberty and when they start to ovulate and release eggs, egg numbers will get less and less and less and dwindle.
Yes.
Once those eggs are used up, finished with ovulation, you run out of your X number, you go through menopause. Women go through menopause. So the eggs do not come back. So with certain chemo drugs, if they affect the ovaries and the cells, they also damage the eggs. So imagine your stock, so your X number gets lesser and lesser, even quicker than they could ovulate. So, and they don't come back. So that of course will cause issues with fertility in the future because you have less eggs. And certain chemo may even affect the health of the ovaries. Therefore, the quality may be affected as well. Same thing with the male testes. If it's damaging to the cells, although the male's testes can produce the sperm, but the cells that produce the sperm may be affected by the chemo agent, and it causes the failure of those cells. Those cells don't regenerate. Those cells do produce sperm, but those cells themselves don't regenerate. So if the sperm-producing cells are damaged, then there may be problems with producing sperm. Hence, the term testicular failure. If it's total testicular failure, then it's going to be a big problem because we won't be able to get sperms from this gentleman. Yeah.
Okay, I see.
But just to add on, right, I think there's this wrong perception, for a lot of patients is that, especially female, is that when they don't have menses, right, they think they are menopause. But it's actually not true.
Yep.
Right? When you do not have your monthly menses or menstruation, doesn't mean that you are actually menopause.
Okay.
So chemotherapy indeed does cause the patients to, they does disrupt the menstruation cycle. So some patients' menstruation will, goes haywire, or sometimes they can just completely stop. That means they don't come. But doesn't mean that the patients are actually menopause. So for us to know whether the patients are actually menopause, normally we need to check their blood, to look at their hormonal level to see whether they actually become menopause or they actually are still not menopause yet, but it's just that they do not have their monthly period, or menstruation. So that's one perception that they actually have to know that. And of course, I think generally, from what we know, right, from studies and from our own clinical experience, is that the younger the patients, right, generally for them, because of the chemotherapy that we give for them to become menopause, right, it's not that high. It's not like 100 patients you give chemotherapy when they're in their 30s, then 100 of them become menopause. No, it's not. Actually, it's much lower than that. But it's only when they are actually without the chemotherapy, when they are reached a certain age group where they are almost becoming menopausal, like in their late 40s or early 50s, then when you give them the chemotherapy, yes, you might potentially actually fasten the process a little, but otherwise, you cause a patient like in their 20s or 30s to, from having their normal hormones level, and then after that, by giving the chemo, then they became menopause. Because I think generally, their ovaries, the functions are still quite resistant, they are still quite strong. Yeah.
So, if they want to check whether they're menopause or not, can they actually also go through like AMH test and transvaginal scan?
Yeah. Basically, it's a whole gamut of tests like what Dr. says for hormone tests, AMH, which is anti-Mullerian hormone test to look at ovarian function, and of course the all-encompassing vaginal scan, transvaginal scan to look at the ovaries, the condition of ovaries. We do a what we call a antral follicle count, whereby we look at the potential eggs that are still within the ovaries per cycle. So all these together actually makes a very, very accurate diagnosis of whether the lady still has, ovarian function or not. Like what Dr. Tan says, menstruation, yes, no, is not a gauge for whether you're menopause or not. Correct. But directly looking to the ovaries, the function through hormones and scan, that will tell us whether there's still hope, so to speak, for this lady.
Okay, so like right now, cancer has been rising in Malaysia, and not just in Malaysia, but the entire world, right?
Yeah.
And right now, I also believe that a lot of people acknowledge that the earlier you test, you can actually have high chances to get better, correct?
Of course.
So, right now they have that kind of treatments for cancer and also for fertility. So it works hand by hand to have this and have that at the same time, correct? So like Dr. Leong, you've been talking about freezing. Freezing for eggs, freezing for embryo,
Sperm.
and also sperms for the men. Okay, so what is the current technology that we have? Those kind of advanced technology right now that we have in Malaysia.
Yeah.
What is it and how successful is it actually?
Well, the healthcare system in Malaysia is very advanced. And people know that, because medical tourism is such a big thing now in Malaysia. We have, for IVF, for example, we have patients from all over the world. I have patients from as far as Europe, Australia, New Zealand, Hong Kong, China, Indonesia, that's coming to seek treatment here because they know, Malaysia is the hub of good healthcare, in our region. So in pertaining to freezing of sperms, eggs, or embryos, so basically in married couple, wanting to preserve their fertility, they can have the option of freezing the embryos because they're a married couple. We can basically do the full IVF spectrum. We get the embryos. We can even test the genetics nowadays. Make sure the embryos are normal. There's no syndromes or anomalies in the DNA. And then we freeze those embryos, which can be used anytime in the future, even if the woman is menopaused. If I transfer those embryos, she can still attain a pregnancy. So it's very good. So it's a full IVF. For individuals who are probably not married yet, they don't have a partner, so they probably be freezing their gametes, either sperms or eggs. Sperm freezing is technically a no-brainer, and also basically we can freeze as many samples as we want, for the future. For ladies, it's slightly more difficult because they have to go through technically like half an IVF cycle. Basically, they start with the injections, they retrieve the eggs, but instead of inseminating or injecting the eggs with sperm, fertilizing the eggs with sperm, we just freeze those eggs. We'll filter the eggs, we'll process them, we'll make sure that they're good for the future, for usable eggs, then we'll freeze them and we'll store them indefinitely until they need to use them. And like we've mentioned before, even post-cancer treatments, they can even get pregnant themselves. So this is just a backup plan. In Alpha IVF, we use cryotech, which is in my opinion the most advanced freezing technology we have today. For example, if it were to freeze embryos, like what we mentioned just now, the survival rate upon thawing is 100%. So the 100%. The lady does not have to worry about her embryos being frozen. It can be frozen for a year, 5 years, 10 years, whatever. When I thought them out, all of them will survive. It wasn't that case, many years back. For example, before 2013, if I were to freeze embryos and they would ask me what happens to my embryos if I were to thaw them out, I say, you may lose some. The quality may drop, but not today. Survival is 100%. Quality stays the same. In terms of eggs, if you were to freeze and thaw, it's still good with cryotech. We minimize the egg loss because egg is just one cell, so they're more prone to trauma. Yeah, so there'll be probably a loss rate of about 4 or 5% upon thawing. Sperms, well, they tend to do worse. We may lose up to 50% of sperms upon thawing, but because sperm comes in millions, right? So it's a loss that I can live with, and most patients can live with, because they come in millions. So it's all good. Yeah.
I understand. Okay, that's very advanced actually.
Yeah, that's right.
Okay,
That's right.
but even I believe like some international people come to Malaysia and seek medical treatments, even in Picaso, even in Alpha IVF. But Do you agree if I say even locals do not aware about this?
Yeah, you're probably right because, like I said, we hope like platforms like these, and other platforms of similar ilk will help educate our general public regarding what they can potentially do, in terms of fertility preservation. Yeah.
I think advancements is definitely one thing, right? I think like what Dr. Leong mentioned, I think in Malaysia, we are definitely on par with the regional, if not internationally as well. Like example, say in Picaso, we are doing a lot of like robotic surgery, which is one of the so-called main thing right now in surgery because it is safer as well as patient gets to recover faster as well at the same time. But to me, I think advancement being just one thing, it's always important to actually treat the patient holistically. That means you treat the patient overall, not just treating a disease itself. So, for example, I think I have a case to share here is that I have a young gentleman, fit young gentleman, 30s. So he was diagnosed with testicular cancer.
Okay.
So he had surgery done to remove one of the testes, right? And then after that, that itself will reduce his risk. His chances of getting, conceived by half already, right?
Correct.
So subsequently, he'll require additional treatment like chemotherapy and all. So to be on the safer side, because he has not competed in family, he only had one child, and he's keen to have more. So we actually, refer him then after that for sperm banking, and then subsequently he completed his treatment, and it's happy for him that after he completed his treatment, he's actually able to conceive naturally. And right now he has 2 kids, and I think his second kid is already 3-4 years old. Yeah, so it's possible to actually for them to actually conceive naturally after the treatment itself.
Okay, as you mentioned, sperms come in millions, right? But for women especially, is it better to preserve first? Because, like you mentioned, we don't know how many eggs we have left.
Yep.
So to be safe, just do it. Or how?
Yeah, if you're talking about cancer treatment, like what we're talking here today, for sure. Yeah, for sure. There's no harm in freezing your eggs, for tomorrow. Even in non-cancer patients or those are not undergoing cancer treatment, like we mentioned, as long as you're aging, we all age, so and you do not plan to start a family now, but probably in the distant future. Yeah, it's good to have some egg banking plan, so that you always save up for a rainy day. Even if all else fails in the future, you don't get a spontaneous or natural pregnancy, you can always fall back on this frozen eggs. Yeah, but of course, if you're pregnant naturally, then very very well. There's no harm in having frozen eggs, stored. Yeah.
Okay, so Dr. Tan, how many years does it take for them to be cancer-free, actually?
So I would say that generally, if you look at the definitions, right, we always talk that someone will be cured of cancer after 5 years, right? Let's say there's no recurrence.
Okay.
But I would say that, that is probably a very loose term or very loose definition. So I would say that it's definitely based on case-by-case basis, right? So like I mentioned earlier, the example of the studies that I talk about in breast cancer patients. So once they have completed their treatment, right, which probably takes about everything between 6 months to 8 months. And then after that, during the follow-up, like say a year or two after that, when their condition has stable, then they actually can temporarily interrupt their treatment to go for pregnancy, and then safely come back to resume back the treatment. So this group of patient doesn't fulfill the 5 years criteria, of curing the cancer before they go for the pregnancy, right? So I would definitely say that it's definitely based on case by case basis. It's also very important for you to talk to your doctors about your wishes and as well, and then what are the options available, and then what are the pros and cons of all these options. Yeah.
So do these patients always, all the time need, explanations about fertility preservation that are available for them, or they just do not aware of it?
Most of the patients don't really come and ask you, right? It's always for us to ask the patient, right? So generally, we were taught during medical school, part of the things that you do during history taking was a social history. So you ask about, how many siblings you have, where are you working, are you married, do you have any children, how long you have been married, whether you have completed your family or whether you have intention of, getting married soon in the future, or do you think that, current number of child is adequate, you think that you want to have more. So these are things that we actually gather during the history taking when we actually talk to the patient during the first consultations. And if let's say we know that this patient's diagnosis require the patient to have some treatment which potentially can affect their fertility, right? Then we offer them upfront to say that, hey, look, okay, your treatment required you to undergo this, right? And this can potentially affect your chance of getting, pregnant or conceive in the future to have your own kids. So, these are the options right now. I think for your case, you probably can wait, for a week or two, at least for male, probably like a few days, but for female, probably a bit longer, see whether they want to consider this. Like I mentioned earlier, it's always very important to give them a bit of time, to digest all these informations. Because the diagnosis of cancer itself is really something very traumatized to many patients, right? So they actually need time, to really slow down and digest all these informations, and then at the same time, do not let them think about it themselves. Always try to get the family members along, to discuss, so that, later on they can make a sane decision so that they will not regret in the future.
Correct. Okay. Just one extra question to Dr. Leong. Other than cancer patient, who else can do this freezing treatment?
Any woman who's in the reproductive age group, can undergo egg freezing, or for the men, sperm freezing. Yeah, so basically it applies to everyone. Trying to preserve their fertility, or preempt future problems. So it's nothing that should stop them in doing so. Always speak to your fertility specialist and get further information. Yeah.
Okay, so Dr. Tan, how does Picaso Hospital support cancer patients throughout their journey? Because just now you mentioned about robotic surgery. You also mentioned you will spend some time to explain to them further about this and that. So other than that, or if you care to explain further about it.
So I think what we try to have is that we try to have everything within one roof, right? And I think when we approach every single patient, we approach them holistically. It means that you actually take into consideration the other factors that's going to affect the patient. So it means you're treating the patient as a whole, as a human, right? Rather than as just a disease itself. So, like I mentioned, at every stage, you try to actually advise the patient, what are the things that they need. So, for example, if the patient needs a genetic testing or genetic counseling, we have a genetic, counselor available in the hospital, which we'll refer to them, to do a counseling before they decide whether they want to proceed with the genetic test or not. Because normally we don't just send them straight for the genetic test, because the implications that come together with the test can be huge, not just affecting the patient, but the family members as well at the same time. Well, of course, like when you talk about specifically on fertility, right, then we will then refer them to our colleagues like Dr. Leong, right, so that the patients can actually undergo whatever that they need to be done before they actually initiate on the treatment. And so that once the disease is being cured in the future, right, they can go on and live their life just like a normal person as much as possible, to have their own families and things like that. Yeah.
Okay, as for Dr. Leong, how does Alpha IVF help cancer survivors or diagnosed cancer patients start a new family?
Yeah, we have like what we mentioned earlier. We have all the modalities. Yeah, from pre-cancer treatment, we do our gonad freezing, gamete freezing. We're talking about sperm freezing, egg freezing. Even very, very young ladies nowadays, we're talking about tissue freezing, ovarian tissue freezing. But we're not starting that in Alpha yet. In the future, we would. At the moment, we are doing egg freezing and sperm freezing. Those who have undergone cancer treatment, if they do not get a child on their own, if they have fertility issues after the cancer treatment, of course we proceed with our various modalities until the gold standard of IVF, for example, which is gives you the highest success rates in terms of fertility treatment. So we will use all our expertise and know-how to help them achieve what they want. Yeah.
All right. Okay. I am very satisfied with all the answers given. So, Dr. Tan, Dr. Leong, before we end the podcast series, do you have any last word to give to all our listeners?
I think generally number one is that everyone is very unique, right? Every individual is unique. Every patient is unique, and every diagnosis is unique as well at the same time. So always talk to your doctors, right, in terms of for your own situations, what will probably be the best in terms of treatments and the outcome that we can achieve, based on the patients. I think try not to be afraid, saying that, because I think that this treatment can, of course, affect my fertility, hence I want to avoid the treatment because I want to have my own family, I want to have my own kids and things like that. I think generally there's always options, right? There's always options. Talk to your doctors. We'll try to find a compromise, and we'll try to find what will probably be the best for the patients, so that probably patient can try to, achieve all the things that they wishes for.
Correct. The world is getting more modern. Definitely, we have a lot of technologies that can cure that, right?
Yep.
Well, Dr. Leong, for you?
Yeah, I think for specific cancer patients or post-cancer patients, post-treatment patients, I think doctors like Dr. Tan and the medical oncologist makes life very easy for us because they're very holistic doctors. You know, they will see these patients because they're the first responders. They will see these patients first and they explain to them all these things. So then they will be referred or they will seek opinion from fertility specialists like us. So it makes life a lot easier for fertility patients in general or people or individuals wanting to preserve their fertility or have fertility issues. Just to say one thing that you should treat subfertility or infertility as a disease, not a taboo subject. Not back in the days, a taboo subject, these kind of things, can't have children, have trouble having children. I keep it under the bed sheets, so to speak. So it should be no different from cancer or any other medical problems like diabetes or hypertension. See your doctor, get it treated. So don't be afraid to come forward and see your doctor for opinion and get treatment if needed.
Yes, especially do not self-diagnose.
Yeah.
Correct. Okay, so thank you. Thank you so much, Doctor, for coming and spending your time for this talk today. So guys, if you have any further question, if you want to go through and see more what are the updates from the Picasso Hospital and also Alpha IVF KL, you may always go through our Instagram, which is at alphafertility.kl and at Hospital Picasso. While for Facebook, you can always go to Alpha Fertility Center or Hospital Picasso, and for the website, alphafertilitycenter.com and hospitalpicasso.com. Well, thank you so much. Tune in for more episodes. Bye.
Bye.